Okay, my name is Melissa Pummell. I'm a nursing student, and I'm going to show you the proper way to do a head-to-toe assessment on a newborn. First off, we're going to start with just the vitals, listening to the respiratory, the heart, and taking a temperature. Okay, the respiratory rate was 24, and then you'll listen for the heart rate for 1 full minute.
You guys doing your...
The heart rate that I got was 110. You can pause. Okay, and then after your heart rate, you're going to do the temperature. You will put one of the caps on it, and you will hold it under the baby's arm to give you the proper temperature. And then you're going to start with the head. You're going to start looking at the fontanelles to make sure there's no depression for signs of dehydration, or if there's any bulging, that can show a sign of intracranial pressure. And then you're also going to take a look at the sutures to make sure they're not overlapping or separating. You just want to make sure everything is just lined up. The capit is basically kind of what it sounds like. It's a cap over the head. It's just a swelling, like edema on the head from going through the birthing canal. And there can also cause a hematoma, which will not cross the suture line of the baby. The hematoma is just, it looks like a swollen area, but it's blood filled. They do eventually go down. Then you also just want to note the shape of the head. With a brand new baby, it may look a little different because they may have what you call a cone head shaped head, but you just want to take a look and just make note of what you see. With the eyes, you want to take a look at the pupils just to make sure that they're responding. Okay. Then you also want to turn the light off to check for the red reflex. You want to make sure you get that reflex. It almost looks like when you take a picture of somebody and they have red eye. That's basically what you're looking for. You also want to make sure the eyes are symmetrical, that they're in line. One is not noticeably higher than the other. And you want to make sure the baby is blinking, correctly simultaneously. You can also check the sclera. This will tell you if the baby's coming down with jaundice. It typically starts at the top of the head and works its way down. And the best places to check is to press on the forehead, the nose, the chin, and also the sternum. You want to check the most bony parts of the body. You can also even check an elbow. You could possibly check a knee. But the best place to start is on the forehead, the nose, and the chin, since jaundice will typically start at the head. You want to make sure there's no bruising anywhere on the baby, just to make sure that they're healthy. You also may notice a little bit of acrocyanosis on a newborn. This is where the arms and hands and possibly the feet are a little bluish color. That's just because the oxygenated blood hasn't got out to those extremities yet. It basically just concentrates on the middle part of the body. But this typically will go away after an hour or so of being born. You also need to check for the Harlequin sign, which is basically half of the baby is normal color, the other half could be more red. And you also need to check arrhythmia toxicum. This is where the baby looks like they're having a lot of red pimples all over their skin. You just need to make sure they don't have any of that. If there is, you don't want to do anything with it. You just want to leave it alone. The ears, you want to make sure they're symmetrical and that they are in line with the eyes, the top of the ear. You could basically draw a line across the baby through the eyes, and everything should just line up perfect. And you want to note the shape of the ears, just to make sure, like I said, everything is symmetrical. You want to note if there's any tags. Could be an extra flap of skin. It's not totally uncommon for that to happen. And if there's any drainage. With the nose, what you can do is put on a glove. And you can slip your finger just right inside the baby's mouth. They will start sucking on your finger, and then you just check for patent on the left and then the right to make sure they're breathing from both sides. While they're sucking on your finger, you can also check their palate to make sure everything is okay. You can also check for ankylosing, which is basically tongue tie. The ligament under the tongue is coming out further on the tongue than it normally does. This causes the baby to have a hard time of eating. You also check for cleft palate and any Epstein pearls in the mouth. Those are basically just white cysts, whitish yellowish cysts along the gums, and you need to make note of this. You want to make sure that their mouth is all pink and that it is moist. The neck, you want to just check the skin folds, make sure everything is okay. There's no excessive. The neck, you can get a lot of infection with the neck folds, so you just need to make sure to keep that area clean. The arms, you want to note, like I said earlier, if there was any bluing, and make sure to explain why there is bluing if they are still a little blue in the hands or in the feet. You want to make sure that the movement of the arms is symmetrical, that there's no flinching by the baby or anything. There could be something wrong. You need to make sure all the digits are there. Babies can sometimes have extra digits on their hands or their toes. The chest, you want to note the size and the shape, and take a look at their nipples. There could typically be drainage coming from the nipples. This is just caused from all the excessive hormones that they've been around over the last 9 months. And you want to check their cap refill and make sure that it is under 3 seconds. Then with their lungs, you'll auscultate and make sure and note if you hear any crackles or wheezing or anything of that such. The apical pulse, like I did earlier when I took the heart rate, it The best place to find it is in the interstitial tissue or interstitial space in between the 4th and 5th. In the abdomen, you also want to note size and shape. You want to listen for the bowel sounds. You also want to check the umbilical cord. You want to make sure that there's no signs of infection, any excessive greenish drainage. If the skin around it is getting red, that could be a sign of infection. You just want to make sure everything is dry and intact. And with the bowel sounds, you just auscultate for those. And with the umbilical cord, you also want to make sure to keep it nice and clean. Depending on the doctor, some doctors recommend using alcohol. Others just say soap and water is just as good. And then with the groin, you want to check for the femoral pulse, just to make sure you can feel it in both legs. And then with a female child, newborn, there could be a slight drainage that you notice in the diaper. It could be a little bloody. This is also typically due to the excessive hormones of being in mother's womb. If you notice any uric acid crystals, it's basically what they look like. This could be a sign of the kidneys of the child not working properly. And you want to check their rectum, make sure they're having a bowel. If they haven't, then you need to make note of it and keep track of that. Circumcision with a boy, they can have what they call a plastibell, which is basically that. It looks like a bell and it's plastic, and they just slip it over the head of the penis and use that for the circumcision. They also have the gomco, which is you put it, the doctor will typically do this, puts it over the head of the penis, and it's treated with Vaseline. You can use Vaseline on that. You do not want to use Vaseline on the plastibell because it could typically just slip it right off. You want to make sure that there's no voiding, or that there is voiding and no bleeding with a circumcision. With the hips, you can do a range of motion with the hips. It's typically not a nursing practice. That's typically done by the doctor. Their skin, you want to make sure that there could be a slight peeling just from being a newborn baby. And you want to make sure that there's no major cracks or anything with the baby, and make sure that they're dry. Keeping them dry is going to help keep them warm. Birthmarks, there are several different types of birthmarks that you want to look for on the child. They can have what they call a stork bite, which is a V shape, either like on the forehead. It can also be on the back of the neck. And they have what they call the port wine, which is a discoloration on the skin, but it's smooth. And then you have your strawberry hemangioma. This is also just a discoloration, but it looks swollen. It could be raised off of the skin. Your neuro, you want to make sure that the baby has a good cry, just to make sure everything is working correctly. You want to make sure that they can suck, which if you did your nose patency, you would find out that, yeah, if they have a good sucking reflex or not. The rooting, you just slowly draw your finger down from the corner of their mouth, and that baby is going to follow your finger, and that's what they call the rooting. We also have the Moro reflex, and that is where you can either raise the baby like this, hold them, and then slightly just drop them. Or another way you can do it is just hold the baby up, and bring them down like this, and you want a reaction from them. If there's no reaction, then there could be neurological problems. You want to make sure that they have good grasp. That as soon as you put your finger in that baby's hand, they're going to grab a hold, and you want to make sure that they do. You also have what they call the Babinski, which is where you take the foot of the child and basically draw an upside down J on their foot. You can use any type of tool, or like the opposite side of a pin. You just want to draw up like that, and you want to make sure that their toes kind of clench in. And then you want to take a look at their back. You want to make sure that the spine is straight. There's no signs of any kind of curvature or anything like that. You can also check for Mongolian spots. This is typically of the darker skin races. It's just almost looks similar to a bruising on the backside, and you need to make sure to let the parents know if the child is born with this. And then you also want to check the sacral dimple. If they have very noticeable sacral dimples, this could be a sign of spina bifida. And then you just need to make sure with their toes that everything looks okay. And that is how you do your assessment with a newborn.